afternoon, everybody. First, we just wanted to, oh, yeah, it's recording. We just wanted to say thank you for taking the time out of your very hectic schedules and busy day to invest in our education. I know each and every one of us really appreciate it, and we appreciate the 10 weeks that you invested in us and helped us grow individually as nursing students. Today we are discussing sharp safety, a quality improvement approach to reducing needle stick injuries in nursing. This is our quality improvement team. My name is Hannah.
I'm Ileana.
I'm Kelsey.
I'm Alexandra.
I'm Aletta.
I'm Ashley.
The prominent statement we wanted to bring to you today is needle stick injuries are a prevalent issue among nurses, posing serious risks for bloodborne infections like HIV, hepatitis B and C, as well as causing emotional distress. These injuries impact nurses' safety, mental well-being, and the quality of care provided in healthcare settings. According to the World Health Organization, 3 million healthcare workers worldwide experience needle stick injuries each year. In the US, the CDC estimates approximately 385,000 needle stick injuries and other sharp-related injuries occur among hospital-based healthcare personnel. Of these, nurses represent the largest portion due to their direct patient contact and frequent use of sharps. Studies indicate that 37% of hepatitis B, 39% of hepatitis C, and 4.4% of HIV infections among healthcare workers are directly related to needle stick injuries. Studies also indicate that $3,000 is spent on each individual injury in hospitals on testing, treatment, and follow-up care. And this doesn't include the indirect costs, related to staff emotional distress, decreased productivity, and potential turnover rates. So to collect our data for our study, we conducted interviews with nursing staff throughout the hospitals, including the IMC unit, ICU, ER, and multiple med-surg units. We explored the staff's experiences with needle stick injuries and their own personal perceptions. We found that multiple injuries have occurred due to leaving uncapped needles in the patient's bed, improper use of equipment, and lack of education on new sharp technologies. We also conducted our own personal observations throughout our individual shifts, and we collected data identifying contributing factors to NSIs, which included insufficient training, improper use of safety devices, improper disposal of sharps, and poor recapping techniques.
So we all did a research on articles. Basically, all of these articles have a lot of the same themes, and these themes are that a lot of the risk factors for needle stick injuries include inexperience, heavy workloads, just being rushed overall, and as well as new devices. And these can pose a threat to potentially having a needle stick injury. Our second article there basically explains how the population who gets needle stick injuries are nurses and also the cleaners as well. People who are cleaning the beds, maybe CNAs as well. They're undoing the linen and potentially can be stuck by the needles left in the bed as well. Our third article here, it just explains how adding interventions and education to nurses and staff overall contributes to less needle sticks in the hospital. Our fourth literature review there, again, it says that implementing best practice definitely decreases the amount of needle stick injuries. And by doing this, we can improve needle safety compliance and overall just reducing the needle stick injuries. Here, my Article 5, again, it states that the people more at risk are the nurses and also people who are handling patients' linen, cleaning up the room. And finally, our sixth article just basically gives recommendations regarding how to handle these needles, how to dispose of them, and overall just to improve occupational safety for nurses. Here's our comparison. So for Article 1, it explains how the compliance with safety measures significant increase after best practice is adapted. Our Article 2 and Article 5 have a lot of similarities on how we should have continuous education for these people who are more at risk, which I did say that would be nurses and also cleaners. Article 3 states that I did say that there was a lot of overall theme on inexperience, heavy workload, and non-compliance with safety measures for most of these articles that significantly increase our risk for needle stick injuries.
Okay, moving on to current sharp safety practices. We were able to kind of figure this out through our own observation on the units as well as talking to some nurses. But first and foremost, there is the implementation of safety engineered devices to reduce these NSIs. There is also the placement of sharps containers in every single patient room that is routinely placed once it is at 3/4 capacity. There is the provision of optional training on NSI prevention through the learning management system. And there is also the availability of needle-resistant gloves. There is also finally established protocol for when a nurse or any worker in the hospital does have a needle stick, and that is kind of provided with the ouch packet that you guys have. And furthermore, these occurrences are tracked by the safety or the quality team to determine if safety improvements are needed.
So after reviewing the literature and the current practices here at Henderson Hospital, we identified some quality improvement strategies. The first is going to be implementing a comprehensive training program. So mandatory training that's interactive that will help ensure that all members understand these best practices. Implementation of real life scenarios and demonstrations to give them the hands-on opportunity to learn how to use the safety devices and how to, what to properly dispose. Annual refresher courses can help to reinforce the techniques and keep everybody current on these practices. And then a visual reminder posted on the units can help with a daily reminder, which we'll go over a little bit more here in a minute. The next strategy focuses on environmental safety audits. So regular audits, especially in high-risk areas, help identify hazards early on. These audits would pay particular attention to areas like sharp disposal, workflow, and device placement to ensure that they meet safety standards and minimize risk to patients and to staff. And the final strategy is to streamline reporting and tracking. With the research and interviews that we did, revealed that nurses may not report needle stick injuries if there was no risk of patient contamination, or if they were not concerned about the patient's infection status or the medication exposure. So to address this, we recommend non-punitive reporting to encourage that all incidents are documented. That way you can gather more complete data, identify the trends, and make safety improvements. So these strategies would create a more safer and efficient workplace.
And then just bouncing off what Alexandra said, for the comprehensive training, not only on existing safety devices, but new ones that the hospital implements as well. Obviously healthcare is a very ever-changing field, things change all the time, so it's important to keep all employees up to date on current practices. And another recommendation that we came up with is to foster a culture of safety among the workplace. Obviously work culture is important, and a comfortable but safe work culture is especially important. So we want to create the norm to be that you report a needle stick even if you think that it's unimportant, and we want to emphasize the non-punitive actions for reporting needle stick injuries.
Okay, so we have two educational tools in front of you that we created, and we went ahead and got some feedback from some of the floor nurses, IMC and MedSurg, and through this feedback, they said that the one-page handout was really efficient because it was more of a visual reminder what needs to go into sharps, and having this available at the nurses station in the med rooms and above the sharps containers as more of just a visual reminder. So on the left we have, what is encouraged, always verbalizing. So even if you're working with another nurse and they say, hey, I'm throwing the needle into the sharps container, that way everyone's on the same page and nothing is accidentally left in a patient's room or something like that. And then on the right we have our do nots. So we always try to not recap needles if necessary. I do know that we do have to, especially after drawing up medications. So just remembering the one-handed scoop technique, and then never reaching into a sharps container. And then Elena's gonna go ahead and talk about the brochure that she made.
Yes, so there is a trifold brochure, just an example of some easily available and digestible information, not only just for nurses, but anyone in any of the staff on the floors, what to do when you have a needlestick injury, as well as like health protocols that you should follow as well. And it's just a good reminder and easily accessible for everyone to grab.
All right, so in conclusion, our QI project really focused it on reducing the needlestick injuries. We covered 4 main strategies, so enhanced training and education, comprehensive interactive training that uses real life scenarios that can improve nurse and staff awareness and skills, and then mandatory ongoing education that ensures needle safety remains a top priority. We have environmental safety assessments, so regular safety audits, especially in high-risk areas. That allows us to proactively identify and address any potential hazards related to sharps disposal and device placement. We have non-punitive reporting systems. So by establishing a reporting system without fear of repercussions, we encourage staff to report the NSIs. This then helps the hospital collect valuable data to analyze trends and implement targeted interventions. Finally, promoting a safety of culture. Fostering a culture that emphasizes safety and recognizing safe practices encourage consistent use of safety devices and adherence to protocols. So together these strategies create a safer workplace where we can protect our health and provide better patient care. So let's commit to advocating for safety and supporting each other in preventing needlestick injuries.
And that's it really for our presentation. I just wanted to thank everyone for coming, taking the time to be here with us, and also thank you. I know that we all had a really good experience with our preceptorships. Me personally, I loved it and definitely made me realize what kind of nurse I want to be starting out. So thank you so much, and if you have any questions, now's the time.
Good job. I like your brochure. Yeah. Karen said we should put it in the ouch packets so that they have it when they.
Yeah. You can send a PDF. You guys are more than welcome.
Yeah, that's, it kind of goes over everything that needs to be
That
done,
we need
so.
to do. We'll send it to you guys. Absolutely.
That was good.
Any questions? Going once, going twice?
Should I give you guys like an extra 5 pounds?
Yes.
All right, well, thank you.
Thank you so much.
Thank you so much.